Hello, welcome to those who are joining today. I have the pleasure of speaking with Dr. Manuel Izquierdo, who is a medical director at IVF Life in Spain. And we are going to be discussing ovarian rejuvenation and how rejuvenative medicine can support your fertility treatment. So IVF Life are superb in helping people who may have more complex cases, and so he will be sharing his wisdom today and answering your questions. So please feel free to ask away, and also thanks for those who have sent in questions in advance. I'm going to add him in now. Hello, good afternoon, welcome.
Good afternoon, nice to meet you.
It's lovely to see you again. I've just given you a brief introduction and an introduction to IVF Life in Spain. Please could you tell us a little bit more about your role and the clinic and the complex cases that you see at IVF Life?
Thank you once again for allowing me to meet you. And my name is Manuel Izquierdo. I'm a gynecologist, more than 25 years working in fertility field, assisting patients, helping patients to get pregnant. And I've been working in many fertility clinics here in Spain, most of them treating many patients coming from abroad and interested in the new advances in fertility treatments, new technologies, new approaches. So a lot of experience trying to help our patients. I'm based in Madrid. At the same time, I have the role of medical quality director in the IVF Life Spain group. So I'm in touch with all my colleagues and colleagues from any other clinics here in Spain and around the world.
Fantastic. Well, it's wonderful to have you with us today, so thank you for your time. I've just been explaining that at IVF Life, you support patients who may have more complex cases, and what we'll be discussing today is how regenerative medicine can support fertility treatment. So the first thing I'd like to ask you is about ovarian regenerative therapy. Please could you tell us what that is?
Maybe one of the most recent advances in fertility treatments is trying to improve the ovarian response when we are dealing with low ovarian reserve. Many cases coming from abroad are patients that have previous treatments and they have a question related with the amount of eggs they are able to produce. So the most recent approach here in Spain about the fertility treatments in these cases considered not so easy to deal with is offering these patients what we call PRP. PRP is platelet-rich plasma. It has a lot of different names because basically it consists of retrieving some growth factors coming from the blood and mainly from the platelets. So the idea in this case is trying to promote the awakening of maybe a small being sleeping follicles that at any moment the ovary is containing, trying to help to increase the production of eggs during the ovarian stimulation. And this approach means that we are taking blood from the patient. It's not an external product, not being produced in any other animal or person. It's your own blood, the one we are using to take these growth factors. And here in Spain and in Europe, it goes under a regulation, very strict regulation. So it's considered to be like a medical treatment. When we are prescribing PRP, we are used to have the same rules like when we are prescribing hormones to stimulate the ovaries. So this indication is under the instruction of a doctor, being gynecologist, experienced doctors in this case, because the idea is to inject these growth factors being taken from the blood inside the ovaries. Is more or less the other way around compared with the egg retrieval. We are going through the vagina, guided by ultrasound scan, and we are injecting this sample of filtered blood inside each ovary, and it takes no more than 5 to 10 minutes. Very safe procedure. Here we perform as egg retrievals under sedation, light sedation, not feeling any pain. And the idea is to confirm in the next coming cycles that the ovarian reserve markers have been increased. The main ovarian reserve markers we are considering today are anti-Mullerian hormone blood level and antral follicle count by ultrasound scan. So we instruct our patients to start measuring these ovarian reserve markers after the injection of these factors. And we consider that if working, these factors will take no more than 3 months after the injection. If you see no increase in these ovarian factors longer than 3 months, this means that maybe in this case, the PRP is not helping us to improve this ovarian reserve. So the experience is very limited. It's been tried around the world. There are some publications mentioning that, and our own experience as well, is that around 50 to 70% of the selected patients going to this approach are experiencing an increase in these markers. So if I should say what's the best candidate to consider this, maybe is a woman not being too old. Maybe older than 42 is not going to help us so much, because I want to focus on the fact that we are always talking about quantity, the amount of eggs. We are not improving the quality. Sometimes we are mentioning this like some kind of ovarian rejuvenation. We cannot get younger. We can try to look like being younger, but we are not going to eliminate the factor related with age. So maybe the women being at risk of low ovarian reserve for any given reason, but not being too old, are the ones who get the best benefit from this. Anyway, we always advise our patients about no great medical evidence about this treatment, and we need to increase the amount of cases to confirm if this treatment is not only improving the egg amount, but the final results that in the end is ongoing pregnancy rate and for sure live birth rate.
When you mentioned, for people who may be of a slightly older age, it may not have the same success rates. What kind of age group would it be useful for, and what kind of cases or what kind of reproductive history would you suggest this for, such as recurrent miscarriage, for example? Would that be something that you would want to look into?
Yeah, at this point, we should consider that PRP is not only being applied inside the ovaries.
Right.
We are trying to help patients having problems like you mentioned, recurrent miscarriage, recurrent implantation failure. And in these cases, the approach is a little bit different. The idea is to infuse, to instillate these factors inside the endometrium. The idea is not injecting inside the ovaries. That was the previous approach, trying to increase the response of the ovaries. But at this point, we are seeing promising results in case of very thin endometrium when you are going to be prepared for an embryo transfer. We see promising results in recurrent miscarriage with this instillation.
Yep.
And we are seeing promising results in some cases affected by recurrent implantation failure, not being explained by most of the most common situations like endometrial receptivity, immunology, bacteria, thrombophilia, etc. In this, you previously mentioned complex cases. These complex cases maybe are the ones who have tried everything, the most studied protocols, the most about recurrent implantation failure, for example. And these are the ones who, in my view, maybe could get an option trying with this endometrial infusion. I want to mention as well that in the last European Reproductive Society meeting being held at Copenhagen last July, one of our colleagues in the group, Dr. Bodri, presented a communication telling about our group experience about these endometrial infusions in case of thin endometrium, recurrent miscarriage, and recurrent implantation failure. And in thin endometrium and recurrent implantation failure, not so many cases, 50 to 100 cases were presented. In these cases, he was able to show us that in the group we are having a significant improvement in these ongoing pregnancy rates. In recurrent miscarriage, on the other hand, we need to wait a little bit more because it was a group containing less cases. It's not so common as well. And in summary, a very promising way to offer this option to our patients, always remembering that, as I previously told you, this is recognized by the health administration in Spain and in Europe. It's authorized. This system is many times the one we are using here in the clinic, for example, in Madrid, is a commercial kit being under the CE label. So it's safe enough, being authorized, and we know how to use. The only remaining question is the most important one, to be able to demonstrate that this helping this group of patients. But with these promising results, maybe not so late, we are able to know exactly what kind of patients are the ones who are getting the best benefit from this, okay?
Do you find that patients travel from overseas and from the UK, for example, for this treatment?
Yes, we are asked. Today, for example, later today, I have a meeting with a patient based in United States that in the brief summary I received from the team is they are asking about a PRP to be used in the context of an IVF attempt. So I think is promoting a lot of interest out of Spain as well.
Absolutely. It's groundbreaking treatment, and I know that that's why people travel to you from overseas to have the very best care and for the best technological advances, and obviously PRP being one of those. How long has it been around for, this treatment?
Here in our group, for example, is being tried for about 3 years. And with the commercial kit, we've been trying for more than 1 year. So it's not so old, but we get a lot of experience because patients based locally are asking for it. And as I previously mentioned, patients coming from abroad are asking about this.
Sense.
And once again, we always insist, we are very honest with the patients. We have no so great evidence about this treatment, but in these complex cases that have tried every option available, maybe it could have an extra option trying with this as well, okay?
Thank you for explaining. We've obviously just discussed PRP. What is PRGF, and what's the difference between this and PRP?
Yeah, maybe not. We are talking about the same tree and 3 different branches: PRP, PRGF, and PRF. All of them are based in growth factors. All of them. At that point today is considered to be PRP, quite similar to PRGF. In fact, the commercial kit we are using here in IVF Spain Life, here in my clinic in Madrid, is one based on this PRGF approach. This means that most of the growth factors are coming from the platelets. So it's a very good name to call it PRP. It's a good name to call PRGF. PRGF is maybe an approach telling that we are able to have some extra growth factors being contained in the plasma, not only the ones contained in the platelets. And PRF is a concept being introduced to tell about the fibrinogen, the fibrin, that makes sometimes easier for this fluid to be stuck, to be fully adhered to the tissue, and maybe is promoting an increase in the response. All these 3 questions today are considered where we are offering our patients PRP in the group. So maybe a good explanation, because today we are sometimes considering that maybe they are quite different. They are different approaches, but the most complete one is the one that is commonly used today in fertility treatments, containing, if needed, fibrin compound and growth factors coming mainly from the platelets, and maybe some extra growth factors coming from the plasma as well.
Do you find that most patients come to you asking for this treatment and asking about it, or do you tell patients about it and recommend it to patients depending on their case?
Because based in this kind of communications with the patients, maybe is being spread everywhere. Many patients know for sure about this option. And as I previously mentioned, many patients coming to our office, to the clinic, are asking about this PRP. Oh, doctor, I get in touch with you because PRP. Few cases today are not so aware about this option, and we introduce in the options of the patients if we consider that is a case under the protocol we are promoting the use of PRP. So in selected cases, if we see an indication, we offer. But maybe today, and maybe after this conversation today, maybe most of the times are the patients the ones asking. They are coming here asking directly to have this option. Okay?
Absolutely. And if anyone wants to find out more about PRP or anything else that we've discussed today about regenerative therapy, please do follow our link in bio to speak to the wonderful team at IVF Life, to Dr. Izquierdo and the rest of the team who can give you a personalised consult to discuss your case in detail, and a tailored plan for that. I know that you have upcoming free consultations at an event on the 13th, I believe is tomorrow, and the 14th of December. Could you just explain how those events work, please?
These events are an option for the patients to get in touch with the clinics with no compromise. It's an approach. We are not going deeper in cases because this is like finding a friend, being related with medicine, and you by chance are, last day I was having a headache and I went and I have some blood test. What do you think? So the approach is to tell about our opinion based in general questions related with the case. It's a way to get in touch with the patients, and maybe if the patients finally are interested to have a real medical consultation, they have the option after these meetings to have. So no compromise meeting, very easy to attend because we are open when we are dealing with patients from abroad by video call, very easy. Short time, about 20 to 30 minutes long, and with a general approach, because it's not like a regular medical consultation. Is a general approach about what's our main opinion about some case, and if the patient wants to go deeper inside the questions they are being affected, they have the option to ask for a later medical consultation as well.
Fantastic. Well, if people want to take advantage of these free consults, please do so to book in some time for tomorrow or the 14th of December. And you can follow our link in bio to book that now with no compromise and no fee, following our link in bio. So please do take advantage of this. Last question, if you have time, please, Dr. Izquierdo, is success rates. I think you touched on it, but if you wouldn't mind just reiterating for those who are watching back or joining, how do success rates increase, if they do, when regenerative medicine is used at IVF Life in Spain?
As I previously mentioned, there are not so many cases. I cannot be able to tell you for sure the results when we are dealing with about 100 cases, for example. But in the last European Society Reproductive meeting I previously mentioned, for example, for thin endometrium, we see an improvement in ongoing pregnancy rate and live birth rate about 20%. In these few cases, it was showing a statistical significance. This means that it makes a difference, and maybe this effect is being promoted because of the PRP and not by chance. This is the way doctors are working to know if a treatment or an option is working or not. You need to differentiate between by chance or because of the effect of the proposal. And about ovarian injection of PRP, as I previously mentioned as well, 50 to 70% of patients are showing an improvement in ovarian reserve markers. But as I previously mentioned as well, the main question we need to solve is we are able to demonstrate an increase in, for example, ongoing pregnancy rate and live birth rate. This is maybe the challenge for us, because we don't forget the question is not only to get 1, 2, 3 more eggs. We want to help our patients to get pregnant, to have a baby at home as soon as possible.
So if someone has been diagnosed with diminished ovarian reserve or low AMH, then this could be a treatment option that they discuss with you.
Yeah, for sure. Maybe not forgetting about the impact of the quality being provided because of the age of the woman. So in the end, you need to discuss with the patient about how many eggs you estimate at this age range the patient is going to need, for example, to be able to produce at least one euploid blastocyst embryo. And on the other hand, what is the starting point of the ovarian reserve this patient has, and more or less to calculate how the improvement could be. Knowing these facts and knowing the limitations, maybe the patient has the freedom to decide if this treatment is an option or not. Once again, for example, if you are on menopause, we are not able to revert the situation. This means the ovaries are almost fully empty of follicles and eggs, and it has no sense. But it will depend. As I previously told you, it's an open discussion, precision medicine based in the personalization of the case. And we have the option, but we need to discuss with the patient if in this specific patient is an option, this treatment or not.
Okay. This has been so helpful and useful for our watchers today. So I'm sure many people will be watching back and will be keen to hear more about it and get in touch with the team. So as I mentioned, IVF Life are running 2 free events tomorrow and the 14th of December. So please follow our link in bio to take advantage of that and book a session. Well, thank you very much, Dr. Manuel Izquierdo. It's always a pleasure to speak to you, and we really appreciate your knowledge and expertise.
You're welcome. Happy to share this information with a lot of people that is attending this meeting. And have a very nice day from Madrid, Spain.
Absolutely. Thank you. Someone else just said, thank you so much for the information and your time.
You're welcome.
Absolutely appreciated. All right. We will see you soon. Thanks to those who
See
joined.
you. Bye-bye.
Bye-bye. Bye.
Ciao.